Hi.
Hello.
Good to see y'all.
Yes, good to see you.
Let's have you stand up and let's take a look. So you have a certain amount of rib flaring here. So this pushes here. Let me know if anything I do hurts, okay?
Okay.
At the Pectus and Chest Wall program, we'll see patients of all different ages who have questions about the difference in the shape of their chest. When first learning that you or your child has a potential chest wall difference in shape, a lot of questions might come up. Is this a problem from a health standpoint? Is it going to affect my quality of life? From an appearance standpoint, what am I going to expect as I grow? One of the things that we can do is help sort of set those expectations about how things will progress throughout growth and young adulthood.
We'll see when we do it, but you can actually see improvement of the chest almost immediately. Okay? But what we want is improvement in the chest when he's not wearing the suction device. So that's what this slowly does over time.
The most common chest wall deformity that we'll see is Pectus excavatum. And Pectus excavatum is where the breastbone or sternum sinks inward as we grow. Based on the age of a child, how severe the Pectus excavatum is, and sort of the wishes of that child or family, we have a few different options. One is to do nothing if the issue is mild and if it's not causing any problems. Another is to undergo surgery. The most common one is a minimally invasive repair, which is done through small incisions and involves placing an implant behind the sternum to push it forward and leaving that implant in for several years to allow the body to grow and adjust with that. Sort of think of it as an internal brace to hold the sternum forward. And for some patients where either the defect is more mild or the patient is younger or a patient who really wants to try everything before surgery, we will talk about what's called vacuum bell treatment, where there is an external device that can be placed over the chest, and for the right patient who's willing to wear that for the correct amount of time, we can get pretty good results.
I want to make sure your skin is able to tolerate it first. So you're going to wear it for a half hour, and then each week increase by 15 minutes.
Our clinic is very multidisciplinary. We have our core members who really think about Pectus all the time, and those are our specialized group of nurse practitioners and physician assistants. And then based on which pathway we want to think about as far as treatment, there will be myself or my colleagues as the Pectus surgeons. But then also it may involve seeing a physical therapist, cardiologist, geneticist, pulmonologist. We want to make sure that we customize the treatment to the patient. There's so many fun, interesting ways of sort of solving this kind of engineering problem. Thinking about new ways of using technology is really exciting. One of my favorite things is the day after surgery. Going around and checking on a patient and asking them to look down if they haven't already, because often they haven't. And they look out and they just say, wow, and often they're so happy with the way things look that it just feels really good.